If you are new to this channel, I am Dr. Himadri. So let's see this patient. So what you can see from here, look, this is a baby presented on day 1 of life with this type of sound, and also there is severe retraction. There is severe subcostal retraction. And also we can, and from history we can have that the mother of this baby had foul smelling liquor. So what could be the diagnosis? Another baby presented on day 4 of life, and the baby came to our unit because the baby was not taking feed sufficient. So there was lethargy, the baby was not taking breast milk, and there was poor suck. So what could be the diagnosis? Okay, we will come to this. Let's talk about neonatal sepsis. So, what is neonatal sepsis? Neonatal sepsis is a clinical syndrome of dysregulated host response to bloodstream infection in first 28 days of life. So, what does it actually mean? Look here, there is dysregulated host response, and also there is bloodstream infection. So these are your naughty bacteria. This naughty bacteria actually invaded into the bloodstream, and there is proliferation of this bacteria in the bloodstream. And you know, the neonate actually have a very poor immune system, so therefore they cannot fight this bacteria. So there is down regulation of this immune system. The immune system is immature, whereas these naughty bacteria are multiplying, and therefore you can see there is a dysregulated host response along with bloodstream infection. This is called as neonatal sepsis, and this neonatal sepsis is usually a deep seated infection, that is usually bloodstream infection. Okay, so once again, what is sepsis? The clinical syndrome where there is dysregulated host response to a bloodstream infection in the first 28 days of life. There is actually, this sepsis term is an umbrella. Under this umbrella you can see there is septicemia. That means the bacteria which are present in the blood, actually which invaded into the blood, are multiplying, and also the bacteria may can go to the brain and eventually leads to your meningitis, or it could be pneumonia. Look here, the bacteria went into your lung and eventually causing pneumonia, or it could cause osteomyelitis. So, broadly, neonatal sepsis is classified into early onset neonatal sepsis. That is, the sepsis which is occurring within 72 hours of life is called as early onset neonatal sepsis. And also, there is another variant which is called as late onset neonatal sepsis. The sepsis which is occurring after 72 hours of life is called as late onset. So, let's see what could be the major presentation of early onset neonatal sepsis. Usually, remember, the early onset neonatal sepsis actually comes from the mother, from the genital tract. So the baby is having this infected fluid which is the baby is getting from the mother, and eventually there could be pneumonia because of aspiration of that content. But in case of late onset neonatal sepsis, it is the presentation is usually meningitis. Okay, so what are the risk factors for developing early onset neonatal sepsis? Remember, if there is spontaneous preterm labor in absence of PROM, that is premature rupture of membrane, it could be a risk factor for EONS, early onset neonatal sepsis. Suppose if there is PROM which is persisting for more than 24 hours, it eventually becomes an risk factor. Or it could be, look here, the foul smelling liquor. Okay, foul smelling liquor, or triple I. Triple I means if there is sign of intrauterine infection or intrauterine inflammation, or both, we call it triple I. Triple I is a very, very important risk factor for EONS. And look here, if there is even a single unclean parvaginal examination, when a single unclean parvaginal examination becomes a risk factor. If there is prolonged labor, especially if the first stage as well as the second stage is, the combined first and second stage is more than 24 hours, we call it prolonged labor. Okay, so out of this And also another risk factor, if there is severe birth asphyxia, that means if the Apgar score is less than 4 at 1 minute of life, we call it severe birth asphyxia. So out of the 7 criteria, if there is 3 or more than 3 criteria are fulfilling, we call it significant risk factor for early onset neonatal sepsis. So what is LONS? LONS is, look here, the risk factors. The preterm and low birth weight, or maybe the very low birth weight baby, are actually these are risk factor for your LONS. Or prolonged mechanical ventilation is also a risk factor. And remember, poor hand hygiene, especially what happens after birth, after 72 hours, if the exposure to this baby in the form of poor hand hygiene, that means poor handling of the baby, maybe the poor cord care, all these things eventually leads to late onset neonatal sepsis. That is, the baby is acquiring this infection after 72 hours of life. Okay, what could be the organism? Remember, Acinetobacter, especially gram-negative organisms, are very, very common in neonatal sepsis. Acinetobacter species, this is most common, around 22%. And maybe pan-resistant Klebsiella, E. coli, these are common gram-negative organisms. And gram-positive organisms, we have cons, that is coagulase negative Staphylococcus, or maybe Staphylococcus aureus, or maybe Enterococcus species. These are gram-positive. Okay. So what are the common clinical features? Remember, as we have already discussed in the case, so there could be poor feeding, lethargy, hypothermia, or maybe fever, that is temperature instability, or maybe some respiratory symptoms like respiratory distress, tachypnea, grunting, apnea. Maybe the here we are discussing the system related clinical features. It may be like cardiogenic shock, remember congestive cardiac failure, bradycardia, tachycardia, all are possible. So the CNS manifestations, bulged fontanelle. Okay, this is a very, very important marker of meningitis. There could be seizure, there could be hypotonia, there could be absent neonatal reflexes. So GIT related clinical features like vomiting, diarrhea, abdominal distension, or there could be AKI, that is acute kidney injury. And remember, the there is another clinical feature that you will get in the skin, that is scleroderma, or maybe multiple pustules. And never forget another metabolic clinical feature which is also very, very important, that is hypoglycemia or maybe hyperglycemia. Both of these are very, very important. How will you investigate this a case of neonatal sepsis? Remember, the first thing is sepsis screen. There are 5 parameters inside the sepsis screen blood investigation. Number 1 is your total leukocyte count. The total leukocyte count, if less than 5,000, then we call it significant. And also, if ANC, that is absolute neutrophil count, is less than 1,800, this is also important. And IT ratio, that is immature neutrophil is to total neutrophil ratio, if it is more than 20%. So look here how it is actually happening. Look, so if there is infection, there is sepsis, especially gram-negative sepsis, and the cytokines are actually moving into the bloodstream. These cytokines going into the bone marrow of the baby, and eventually this cytokine basically pushes the immature neutrophil to come inside the blood circulation. Therefore, even before getting mature, the neutrophils are coming into the bloodstream, and therefore there is immature neutrophils are increasing in number. So therefore the ratio is more than 20%. Remember this is very, very important. That is absolute neutrophil count as well as IT ratio, immature is to total neutrophil ratio. Okay, the fourth parameter is micro ESR. Micro ESR should be more than 15 millimeter in first hour as well as the CRP. CRP should be more than 1 mg per liter. So apart from the sepsis screen, another investigations are blood culture as well as LP, that is CSF, lumbar puncture. And there are few modern and rather recent advances or some recent investigations that could be done, like procalcitonin, interleukin 1, interleukin 6. This procal and interleukin 1, 6, these are not done routinely. these are basically kept for research purpose. So, what is called as sepsis screen positivity? If out of these 5 parameters, 2 or more than 2 parameters are positive, we call it positive sepsis screen. How will you be treating this case of early onset neonatal sepsis? So remember, any case of neonatal sepsis, be it early or late onset neonatal sepsis, the primary things should be done. That is, if IV fluid is required, you need to give IV fluid. Suppose say the child is in shock, therefore you need to give IV fluid. Or if the requirement of ionotropes should be given. If any requirements of that is maybe some ventilatory requirements, you need to give it. And also maintain normoglycemia, that is hypoglycemia as well as hyperglycemia should not be allowed. It should be treated appropriately, as well as a normal temperature should be maintained. And apart from this, remember, the main treatment is antibiotics, and before starting antibiotics you should draw the blood culture. This is mandatory. So here in early onset neonatal sepsis, remember, and if any one criteria is present, we can start antibiotics. Suppose if there is presence of risk factor. So just now we told that in case of early onset neonatal sepsis, there are 7 risk factors, and out of these 7 risk factors, even if 3 or more than 3 risk factors are present, we can start antibiotic. And also, if out of the 7 risk factors, only 2 risk factors are present, and apart from this, if there is positive sepsis screen, we can start antibiotics. And in case of suspected or confirmed triple I, and what is triple I? That means if there is signs of intrauterine infection or intrauterine inflammation, or maybe the both of this, we can start antibiotics. And also, if there is strong clinical suspicion, remember, if there is strong clinical suspicion, even absence of this sepsis screen or risk factor, we can still start antibiotics. In case of late onset neonatal sepsis, if blood culture is positive, and also there may be strong clinical suspicion, in this ground we can start antibiotics in late onset neonatal sepsis. So which antibiotic should be started? The first line antibiotic is always ampicillin and gentamicin. That is usually done. Look here, usually this is beta-lactam as well as aminoglycosides, because gram-negative organisms are very, very common. That's why, so the broad spectrum coverage by beta-lactam as well as the aminoglycoside, which is giving the gram-negative coverage, is very, very important. That is given here. So remember, the choice of antibiotics basically depends from institute to institute, depending upon the local susceptibility pattern of this bacteria. Okay. And also remember, in case of staphylococcus, when you are suspecting staphylococcal infection, in case of MSSA, that is methicillin sensitive staphylococcus aureus, usually cloxacillin is used. In case of MRSA, vancomycin. In case of VRSA, that is vanco resistant staphylococcus aureus, linezolid is used. Then that is the treatment of choice. In case of pan-resistant pseudomonas, usually, remember, in case of pseudomonas, we give the first line antibiotic as pipzo and amica, that is piperacillin tazobactam as well as amikacin. Of course, we will be changing this antibiotic depending upon the culture sensitivity pattern, if there is no response within 48 hours. Okay. So another thing which is very, very important is the duration of antibiotics. Remember, in case of meningitis, it is mandatory to give 21 days of antibiotic. Suppose if it is a case of neonatal sepsis with blood culture positivity, you have to give 14 days of antibiotic. And also, if the culture report becomes negative, that is this is a clinical sepsis with negative culture, we have to give antibiotics for 5 to 7 days. Okay. So what are the indications for doing CSF? In case of early onset neonatal sepsis, if blood culture is positive, we have to do CSF. Okay. But in case of late onset neonatal sepsis, all cases will be doing blood culture. Okay. In case of late onset neonatal sepsis, irrespective of the blood culture, we have to do CSF. And also, if there is, suppose a baby comes with clinical features like seizure, which could be a presentation of meningitis, as well as the seizure can happen because of hypoglycemia, maybe hypocalcemia. If we have ruled out all these metabolic causes and all other causes which could be contributing, we can attribute this seizure as meningitis. Therefore, In case of CNS features which are suggestive of meningitis, we can do CSF or lumbar puncture. Thank you. So what are the indications for doing CSF, that is lumbar puncture? Remember, in case of early onset neonatal sepsis, if the blood culture report came out to be positive, you have to do CSF, that is lumbar puncture. In case of late onset neonatal sepsis, irrespective of the result of blood culture, you have to do CSF, that is lumbar puncture. And also, suppose the baby comes with history of seizure, okay. So this seizure is could be due to some metabolic causes like maybe hypoglycemia, hypocalcemia. When you have ruled out all these causes of like hypoglycemia, hypocalcemia, or some other electrolyte abnormalities, so in these cases you are strongly suspecting it could be a case of meningitis. In that cases you have to do LP or CSF. Okay. Therefore the CNS features which are suggestive of meningitis, you have to do CSF. If you are still watching me, you could have liked this video. For more such lectures in the future, please consider subscribing and sharing with your friends. Thank you.